Hi, my name is Fernanda Garcia Perez. I'm going to talk about procedural sedation and analgesia in children. Definition. Procedural sedation and analgesia involve the use of one or more sedated and analgesic agents to relieve pain and anxiety and to control motor activity in patients undergoing diagnostic and therapeutic procedures.
My research topic is on procedural sedation in children, and I investigated the quality of this technique in Dutch pediatrics. First one is that we showed that the common sedation practice in Dutch pediatrics is unsafe. Second, we showed that a lot of sedation practices are also ineffective. In the first place, we conducted a nationwide survey using a questionnaire. We did that together with the Department of Clinical Epidemiology. Next, we did several systematic reviews of the literature. And finally, we designed a new guideline, evidence-based guideline on this topic, together with specialists in the field. Sick children, they at first will experience more comfort and less pain during their stay in a hospital. And next, when they are sedated, it will be more safe for them. In fact, to find a solution for a daily clinical problem in our patients. First was that we used techniques coming from social science, and that for me as a medical doctor was completely new. And second, we had to do a lot of collaboration with other specialties. So also collaboration and discovering new people was highly interesting. Most importantly, we had a very good collaboration with the Department of Anesthesiology. Solving the problems of sedation in children, you need the collaboration between anesthesiology and non-anesthesiology specialists. And in this hospital, which was really unique in our country and even in Western medicine, we had this collaboration. So that was essential. To be a good doctor, to generate excellent care for sick children. I hope that in the coming 10 years, we will be able to implement these findings in daily clinical practice. So that's the most important thing, in fact, that children will experience more comfort, less pain during their stay in the hospital. The most important eureka moment for myself was that my colleagues joined me in the efforts to find better solutions for sedation in children. So I was not a Don Quixote anymore, but just walking together with the rest to a better future.
Applications in medicine. Evaluate characteristics of pain using therapeutic communication strategies to recognize the experience of pain and show acceptance of the patient's response to pain. Observe non-verbal cues of discomfort, especially those who cannot communicate effectively.
Important to have reversal drugs readily available. In addition, you must know the route, dose, frequency, and side effects of reversal drugs. Naloxone, or Narcan, is a drug that reverses the central nervous system depression and respiratory depression caused by opioids such as morphine sulfate or fentanyl. Narcan is given in a dose of 0.1 to 2.0 milligrams IV push. When giving Narcan, it's important to try to reverse the effects of opioids carefully to improve respiratory effort without eliminating analgesia. To achieve this goal, Narcan is given in small doses that may be repeated every 2 to 3 minutes if necessary. Be aware of the possible adverse effects of Narcan: nausea, vomiting, seizures, and in extreme cases, hypotension, hypertension, ventricular tachycardia and fibrillation, dyspnea, pulmonary edema, and cardiac arrest. Remember also that when the opioid effect is fully reversed, the patient will feel pain. Partial reversal with preservation of analgesia and return of intact airway reflexes and respiratory drive should be the ultimate goal. To reverse the sedative effects of benzodiazepines, flumazenil, romazicon, is given. Romazicon reverses the sedative, but not the respiratory depression effects of benzodiazepines. Romazicon has a rapid onset and a short half-life. Its duration of action may be shorter than the benzodiazepine drug it's reversing, so it's important to monitor for recurring sedation and respiratory depression. Romazicon is given in an IV bolus dosage of 0.2 milligrams over 30 seconds and repeated at 1-minute intervals for adults. If patient is greater than 1 year of age, the recommended initial dose is 0.01 milligrams per kilogram, up to 2 milligrams, administered intravenously over 15 seconds. Possible adverse reactions include anxiety, agitation, increased muscle tone, hyperesthesia, and possibly convulsions.
Pros and cons. We have the capability to safely and effectively relieve children of the pain and distress associated with medical procedures. Accordingly, procedural sedation and analgesia have become the standard of care for children and are widely practiced worldwide by a diverse group of specialists in both inpatient and outpatient settings.
Caudal block is an important part of the pediatric anesthesia. This video we'll see how to perform a caudal anesthesia. Two sacral carnua are identified by moving the fingertips, and the puncture is performed between the two carnua. After crossing the sacrococcygeal ligament, the needle is redirected 30 degrees and advanced. So the patient has been painted and draped, and we will see a live demo of how to perform a caudal analgesia. The one which is sacral, and then it will be the sacral hiatus. So this is on sacral cornu. I can feel the other sacral cornu, and then if you press here, there will be sacral hiatus. So if the sacral hiatus, if you put in the base, you reach the bone. So once you felt the sacral hiatus, go a little up. Then you will go to you will feel the fourth sacral spine. So in that space, some people don't know. What I do is I do a little bit of a skin breaker, so the skin is not taken into its cord. These are all small things which is okay to that. And then go at 45 degrees, single one, and then I got it. Once you got it, you will depress a little bit, and then hold it. And hold it tightly so that it doesn't go inside. Aspirate once. If you aspirate once, the air bubble increases, that means it is in the space because it is neither in the vessel or it is in the CSF canal. Once your vessel is okay, give about for the remaining. Again, aspirate once and make sure the air bubble is increasing, that means you will not push it. The holding of the needle should be so tight that you don't push it inside into the spinal canal. So the resistance should be good. You must take more than the same syringe all the time, same size of the needle all the time, because you don't change the resistance of whatever it is happening. The child is about 10 kilos, but I want a level up to T7. So I give about 1.2 ml.
Issue plating in Ecuador. In Ecuador, pain therapy is always used to reduce pain in patients, and scales to evaluate its characteristics are used.
Example 1.
Caudal. Example
The child
1.
is anaesthetised, monitored, and positioned in the left lateral position, with the legs flexed at the hips and bent at the knees. After full personal sterile preparation, prepare all equipment and drugs. Local anaesthetic to be injected must remain sterile. Prepare the sterile field with sterile cleaning fluid, prepping in a circular motion from inside to outside. The posterior superior iliac spines are palpated with the index and ring fingers, and the sacral hiatus is then palpated between the sacral cornu with the middle finger as shown. Prep a final time, allow to dry, and apply the sterile drape. Local anaesthetic is checked and drawn up in a sterile manner. Re-identify the sacral hiatus. The needle or cannula, shown here, is inserted at the hiatus and advanced at an angle of 45 degrees to the skin, aiming towards the head. Gently insert until a pop or loss of resistance is felt. Take special care with needle advancement in infants. Advance the cannula off the needle into the space. Remove the needle and observe the cannula for blood. Gentle aspiration confirms a negative pressure and no blood or cerebrospinal fluid. Connect the local anaesthetic syringe. Confirm negative aspiration. Slowly inject the prepared dose of local anaesthetic. The injection should require minimal pressure and no subcutaneous distension should be seen. Aspiration mid-injection confirms no displacement of cannula. Continue steady local anaesthetic injection. On completion of the injection, remove the cannula, reposition the child supine, and ensure child is stable.
Conclusion. Pediatric procedural sedation and analgesia use multidisciplinary technique that is used to manage procedural anxiety and pain. It is effective and generally safe when performed by appropriately trained practitioners. The ultimate goal of procedural sedation is to provide a painless, non-traumatic experience for children who are undergoing a diagnostic or therapeutic procedures.
A lot of times kids are scared to get on their hospital bed. Catherine Davis knows what kids like. So if there's a toy up there they can readily play with, they'll jump right on and start playing with it. As a child life advocate with the Children's Hospital, her job is to keep kids distracted when they're undergoing lengthy medical tests. I'm focusing on getting them through their procedures. So whether it's an IV or an MRI or a CT scan or anything in radiology. She doesn't administer sedation or assist with the test. Her focus is purely on keeping kids happy. My favorite is the iPad. I say part of my job is finding new apps, which is always fun. Anything to just kind of try to keep their focus away from the actual IV stick is helpful. In January, 10-year-old Drew underwent an MRI because doctors needed to see if his pituitary gland was working.
I was very concerned naturally because Drew has a problem with his veins where they're very deep set in and they collapse easily.
In Drew's case, they pulled out the iPad. It kept him from being stressed out while they found a vein and gave him the sedation that put him to sleep.
We were all surprised that he did so well. And I was so pleased. I mean, I was really blown away.
Just one more happy kid, and all in a day's work for Catherine.
Making sure that we can do everything to foster proper development and not traumatize them in any way.
For Lee Memorial Health System, I'm Amy Osher.
Thank you.